Metabolic disease is assessed by taking into consideration the patient's body composition, their fasting blood glucose levels, a higher elevated blood pressure, as well as higher triglycerides and reduced HDL-C. For this assignment, I've chosen to discuss the assessment tools of the patient's elevated blood pressure, waist circumference, as well as the fasting blood glucose levels. This is because that while they all prove to serve as valid methods to objectively assess a patient, they also allow for the indication of additional comorbidities that often couple up with metabolic disease, and they also provide a healthcare physician with a foundation for further investigation into what this patient may be suffering with on a day-to-day basis. For each of these assessment tools, I'll discuss how each patient should prepare for each procedure, what to expect, as well as how the procedure is performed and what values a physician is looking for and what they may gain from that newfound information. So first, I'll go into talking about blood pressure. So when assessing a patient's blood pressure for the purposes of evaluating for the presence of metabolic disease, there are several things that the patient need to consider before their assessment, such as they need to avoid the ingestion of caffeine or smoking, as well as participating in vigorous physical activity for about 24 hours before their examination. They also should probably take their normally prescribed medications to allow the physician that's going to assess them to appreciate what's their normal baseline measurements from a day-to-day basis. And then after the patient has arrived and they've checked in for their examination, it's important that they've remained seated in a chair that offers both back support and allows them to have their feet placed firmly and flat on the floor for no less than 5 minutes to allow them to come down to an accurate resting blood pressure. Once the patient's been seated for an adequate amount of time, the patient's arm should be placed on a surface that's about heart level. If there isn't a surface available, whoever's reading their blood pressure could either they could kneel beside the patient, place the arm of the patient on their shoulder, or they can place the arm of the patient between their own rib cage and their upper arm to hold that arm in place. That way you get as close to heart level as possible. Basically, ultimately, where the individual's arm and hand end up are based on both the environmental setting that you're in and also whatever that patient is comfortable with doing. Also, it's worth mentioning that the patient's arm should be relaxed, not flexed, and their elbow should be slightly bent with their palm open to keep that arm nice and relaxed. So then you'll place the blood pressure cuff on the patient's upper arm. You're going to put it you're going to pretend my hand is the cuff. You're going to put the cuff about 1 inch above the antecubital fossa of the elbow. So you're going to place it about 1 inch above this area here. And then the tubing that's coming out of the blood pressure cuff, you're going to align it with their brachial artery here. Then you're going to place the stethoscope just below the edge of the cuff and just above the antecubital fossa of the elbow. And then once everything is in place, you're going to rapidly inflate that blood pressure cuff to about 20 millimeters per mercury above the first carotid cuff sound you hear. And then you're going to slowly release the air out of the cuff at a rate of about 3 millimeters per second. And then while you're doing this, you're going to do two things. You're going to listen carefully for the first of 2 or more carotid cuff sounds. And then you're also going to be watching the dial on the blood pressure cuff and observing it for a bouncing rhythm that coincides with the sounds you're going to be appreciating. So that first sound is going to be the patient's systolic blood pressure, and then as soon as that sound dissipates, that marks the patient's diastolic blood pressure. For the initial examination, it's important to measure the patient's blood pressure in both arms 3 times, and each measurement in both arms should be 1 minute apart. So typically, a physician or nurse will plan this out by they'll just alternate between left and right arm. That'll give them about a minute between each measurement on each arm. And then it's also really important to note what size cuff you're using. If a blood pressure cuff is too large, it'll underestimate a patient's blood pressure, whereas if it's too small, it'll overestimate the blood pressure. So that's really important to note. I have been in a situation where you're caught between a couple different sizes and you're not sure which way to go. A long time ago, someone taught me that a good rule of thumb to go by is if you pick a blood pressure cuff whose bladder is about at least or slightly over 80% of a patient's circumference of their arm circumference. That's kind of a little rule of thumb. Can't say it works for every situation. Just a little tip I've learned along the way. So the patient's systolic and diastolic blood pressure is assessed separately, and then depending on whichever reading is higher, that dictates what category their level of blood pressure or severity of blood pressure is in. So if a blood pressure is 130 over 85, that's described as being hypertensive, and this value is absolutely relevant to an individual with metabolic disease, because it's actually been found that 80% of individuals with metabolic disease also suffer from hypertension. So in a patient that may have metabolic syndrome, the confirmation of hypertension is alarming, just simply by the fact that metabolic disease can amplify these hypertension-related issues such as target organ damage. And this can be observed in things such as left ventricular hypertrophy, aortic stiffening, or even microalbuminuria. So those are things to be aware of and understand how they tie in. Next, I'll go on to discussing waist circumference. This is a really important tool as far as body composition goes, because it can really tie into some comorbidities we'll discuss here in a moment. So once the patient's baseline vitals have been measured, the healthcare professional will use a fabric measuring tape to gain a picture of the patient's overall body composition by assessing their abdominal obesity. So this value proves to be really valuable in assessing a patient for the presence of metabolic disease, in that it can be predicative of future comorbidities that are really common in this population, such as hypertension, as we've already discussed, type 2 diabetes, and coronary artery disease. So you'll have the patient stand up with their arms down by their sides. They're going to stand up nice and tall, and the physician or nurse or whoever's performing this exam will take the tape measure and place it in the narrowest point of the individual's abdomen between the umbilicus and the xiphoid process. So it would be about here on myself. So obviously for this, the patients will need to be in form-fitting clothing that's not constricting, or if it's a cooler day and they need to wear something a little heavier, they can certainly wear layers and just remove those layers temporarily while their waist circumference is being measured. So the healthcare professional will measure that waist. It'll be measured in centimeters, and it'll be measured twice, and the average will be taken. But both of those measurements need to be within 0.5 centimeters of each other for it to be a valid assessment. As I've already talked about a few minutes ago, waist circumference is a really strong indicator of metabolic disorder because it can effectively identify the risk for cardiometabolic diseases, especially in individuals too that appear to be of normal weight. So that's really important to note. Okay, so a male or female patient is at risk of metabolic disease if their waist circumference is greater than 100 centimeters or 90 centimeters, respectively. An elevated waist circumference warrants caution because it correlates to a higher amount of abdominal adipose tissue within the individual, allowing for an estimation of visceral fat that can be tied into, like I said, type 2 diabetes, hypertension, a lot of your vascular diseases. So this is something that really needs to be paid attention to. And then finally, I'll go into discussing fasting blood glucose levels. This is used to assess patients with metabolic disease. I've already mentioned type 2 diabetes, so it'll tie into that in a minute. So this also indicates not only just, it's not automatically going straight to type diabetes, but it's also really important to understand that when you see you're looking at these values for the fasting glucose levels, that you're really looking for the glucose tolerance of that individual and seeing how well their body is at utilizing this substrate. So while hyperglycemia is a serious condition on its own in that it can increase a patient's risk of developing type 2 diabetes, it also increases their risk for vascular diseases of the heart, brain, eyes, kidneys, because it all ties in together. So when patients prepare for a fasting glucose test, they'll be asked to refrain from eating or drinking anything other than water for 8 to 10 hours before the test. Since this is the case, an individual that's taking an individual that's planning their exam needs to it's usually easier for them to do so first thing in the morning, and plan it in around their regular meal time so they don't have to miss breakfast necessarily, or they can, it also helps them so that they don't have to fast an entire day and then do their test at the end of the day. A lot of patients often bring their meals and medications with them so that they can take it right after the test. Also, if an individual is currently on any specific medications, whether or not to take that medication or if they should alter that dose of the medication really depends on that individual's unique care plan and overall health. So that's a discussion that they need to be having with their physician prior to this test and plan accordingly. Also, although risks with this type of test are really rare, it's important for patients to understand that there's certain things that could occur, such as a really minor hematoma at the blood draw site, even the risk of infection because you're opening your skin. Also, there's the chance that they may have to be poked a couple different times. So depending on the individual's comfortability, that's something to consider. So a blood sample can most likely be collected in most situations using a simple finger prick. A technician will usually sterilize the draw site with an alcohol swab. Usually the index finger or middle finger are kind of the prime fingers to use. They seem to be the best at drawing blood out of. And then a lancet will be used to prick the finger and draw blood, which will be then collected in a small capillary tube and sent out to the lab to be evaluated. And then a physician will usually call the patient and follow up and discuss the findings. Things to note: it's easier to draw blood if the patient's hands are warm and relaxed. And then also, it's not really uncommon for sometimes if you've poked that finger and then you poke it and you expect blood to come out and there's no blood pooling. So sometimes it'll be needed to kind of, they call it milking the finger or milking the vein, and you just kind of push the blood down into that draw site and it'll pool and you can collect it then. And then once you've collected your sample, you can apply some compression to that draw site with either usually like a 2x2 gauze square or a Band-Aid, and they're good to go. So a normal fasting blood glucose range is between 70 and 99 millimoles per deciliter. And then an elevated fasting blood glucose level of anything greater than 100 millimoles per deciliter is indicative of hyperglycemia. And this will indicate if the patient is either pre-diabetic or diabetic. Usually pre-diabetics are between 100 and 125 millimoles per deciliter, and diabetics are anything greater than 126 millimeters per deciliter. And then hyperglycemia, this is important to be aware of because it's indicative of chronic insulin resistance, and if the patient is at increased risk of developing heart disease and stroke. So assessment of metabolic disease using a patient's waist circumference, fasting blood glucose levels, and elevated blood pressure will influence the course of treatment an EP will prescribe for an affected individual. Also, while supervising and prescribing the patient's exercise program, the EP will know from having learned of these values to be extra vigilant in monitoring for specific cardiac signs and symptoms during exercise, along with signs of exacerbation of their conditions, possible underlying conditions such as blurred vision, dizziness, easy fatigability, palpitations. So though that's important during their supervised exercise sessions. Also because metabolic disease is such a huge contributing factor to the development of other comorbidities, the EP obviously is essential in recognizing risk factors and implementing methods to reduce them as major components from the patient's lifestyle. And then it's really also important for the EP to take the knowledge that they've gained from these assessments and evaluating the patient and having a really sit down, open, honest conversation with these patients about some modifiable lifestyle changes, risk factors such as reduced weight, healthier nutrition habits. That's really important. Also, the increase in physical activity, that's going to be a conversation that they really need to be having with that patient. Also, when they go to prescribe this exercise program, they'll also use that information to really cater it towards an individual as if they had cardiovascular disease and possibly even diabetes, to prevent the occurrence of adverse events while they're exercising. All this is really valuable. About 35% of adults in our country struggle with metabolic disease, and it's really expensive for our healthcare system. So individuals with these markers can be properly assessed and treated accordingly and improve their lifestyle and reach some goals of theirs, and hopefully to ultimately reduce their risk of mortality and morbidity prematurely.